Snoring can be annoying, can be frustrating, can be embarrassing, and can cause problems in relationships. Unfortunately, a lot of people snore. Some people don't even know that they snore. Now, most recently, it's been found that about 90 million Americans have reported that they snore at one point or the other. In general, about 70% of the population snore. Most people snore not on a regular basis, but a good number, however, snore regularly. In today's video, I'm going to share with you some reasons why you snore and what you can do about them. So keep watching and let's dive right into it. So let's start with what snoring is. So snoring is a respiratory sound that is generated by the upper airway during inspiration and exhalation, typically when we exhale, but can happen when we inhale as well. Now, this sound is a sign of obstruction in the upper airway. And so why is snoring a problem, right? Why are we concerned about it? Now, snoring can be a sign of obstructive sleep apnea in the sense that when you snore and you have sleep apnea, you're not getting oxygen, right? Because the upper airway is obstructed. So you're breathing in while you're sleeping, but you just can't get the oxygen to the tissues in the body. Now, this can lead to many medical problems along the line, complications long term. Now, aside that, we know that sleeping with someone who snores is not a nice thing to have around, right? It causes problems in relationships. Have you heard about sleep divorce? That's really when people who are married can't sleep in the same space, the same room, share the same bed because one party snores. And so that causes a big strain on relationships. Now, let's talk about why people snore. Number one, nasal congestion, right? So think about those days that you had a cold, a flu, or some allergies, and your nose was stuffed up and you couldn't breathe, right? And so that causes you to breathe with your mouth open. And that could cause snoring sounds when you lay down to sleep. Now, this typically resolves when you feel better. And so not so much of a concern, but does happen when you're congested. Number two, obesity. As weight increases, the size of the neck also increases. The soft tissue around the neck increases. And what happens? All of that causes a narrowing of the upper airway, and that can cause snoring. And so this is one main thing that we find in people that have obstructive sleep apnea. And this time around, the snoring does not resolve over time, except you lose weight. So this is a really, really big contributor to snoring. Number three is aging. As people increase in age, the muscles around the upper airway sag, relax, and so that causes obstruction during sleep, and that causes snoring as well. Number four, sleeping position. People that sleep on their back typically tend to snore more than people that sleep on their sides, left or right, it doesn't matter. And on their stomach, right? A lot of people sleep that way. I know that seems a little bit off, but yes, there are people that sleep on their stomach. Some people sleep with their head over their pillows, and that's okay. But we have found that sleeping on the back worsens snoring. And why is that? So when we lay on the back, the tongue falls over by gravity and covers the upper airway. And so that's one position to avoid if you are snoring. Next is alcohol. Now, alcohol causes snoring by causing relaxation in the muscles of the upper airway. And this is especially common if you're drinking alcohol close to bedtime. And guess when people love to drink alcohol? With dinner, right? That's when people like to drink. And so making sure that you're spacing out alcohol use between when you have it and when bedtime is one way that you can reduce or improve snoring. You want to have at least 3 to 4 hours of gap before going to bed to make sure that that doesn't affect your nighttime sleep. Number 6 is facial anatomy. Some people have a really small mouth, high arched palate, and so when they lay down to sleep, the tongue falls over the airway, and so there isn't room for them to get oxygen. And so this goes together also with having a really large tongue. So the combination of a small mouth and a large tongue is really what predisposes them to having this sound of obstruction, which is snoring. Number 7, the last but not the least, found in children is enlargement of the tonsils and the adenoids, right? Very common in children. And so with enlargement of tonsils and adenoids, again, that closes in on the airway and can cause obstruction leading to the snoring sound. So these are 7 reasons that can make people snore. The really big ones in adults are obesity and facial anatomy. And the dentists are really good at finding people that have a small mouth, and they send us referrals when they find this kind of patients. And why is this one really important? Now, you do not have to be obese to snore, because if your mouth is small or you have a large tongue, you will be at risk of snoring. Now, children, most commonly, the big one in children is enlarged tonsils and adenoids. So those are the really big ones out of all of these. Now, if you're snoring consistently, then you want to get it checked out, right? Because like I said, you could be at risk of obstructive sleep apnea, which has long-term complications. And I'm going to put the link to a video where I explained the complications of untreated obstructive sleep apnea. You want to listen to that video and learn why it is crucial for you to treat sleep apnea if present. Well, I hope this video has helped you. You've understood a little bit more why people snore and a few tips on what you can do if there are lifestyle changes that you can make that can improve snoring. I'll see you in my next video. Thanks for watching. Bye.